Hello, I'm Richard Tapper. Because you're here to discuss vasectomy, there are several things I'd like to relate to you prior to my coming in, examining you, and answering your questions. A vasectomy is an operation, and it's an operation like any operation. And because of that, it has possible complications like any operation: pain, infection, and bleeding. They don't happen very often, but they happen, and because of that, I just mention it. Another thing that happens, and fortunately it happens infrequently, but happens, and that is sometimes a vas can grow back together. It depends on which article you read, but it can happen anywhere between 1 in 200 and 1 in 7,000. But when it happens to you, it's 100%, and you don't really care about those other people. Because there is that possibility, although it's rare, we ask that you bring a sample back to the office besides the ones that were mentioned in the papers that were given to you at 2 months, 3 months after that, 6 months after that, and once a year thereafter, just to check to make sure everything is staying the way we left it. The chances of it growing back together are slim, and the chances of putting it back together are slim. Therefore, you have to assume once it's done, it's going to stay done. It could be sterile the rest of your life, and that's the purpose of having it done. That's also the reason that we ask that you bring your spouse with you if you're married, so that everybody understands what's happening. It's just not worth it to me to have some wife chasing me around yelling, "What'd you do to my husband?" We want to make sure everybody understands what's going to happen. After you have it done, you won't be any different than you are now. The same amount of ejaculate will come out that comes out now. You won't be able to do anything more or less sexually than you can do now. And you won't be able to play the piano if you can't play the piano now. We normally do it back in our surgery center. It takes about a half hour to do. There's one incision about 1/4 of an inch long. There's one stitch. It comes out itself. You don't have to come back unless you have a problem. We use an anesthetic agent, which is about the same as the dentist uses. It's a shot in the skin, not a shot in the testicles, so it's like a shot anywhere else. It hurts for a moment, and then it doesn't hurt anymore. And it's not near as bad as you're sitting there thinking. It's a simple thing to do. It's simple on you, although we do ask that you don't go to work afterwards that day. The next day you'll be a little bit sore, but you should be able to do your normal thing within reason, and by 4 or 5 days you should be completely back to normal. We give you antibiotics to take so you don't get infected, and we don't usually have to give you any pain medicine. A couple aspirin or Tylenol or Advil or Motrin is really all you need for discomfort. We also ask that you bring somebody with you to drive you home in case you need it. You probably won't, but in case you do, we want somebody here with you. You may have heard about a correlation between cancer of the prostate and vasectomy. Several years ago, there were a few articles that referenced this fact. However, recently there's been several articles that show that there's no correlation whatsoever. The American Cancer Society and the American Urologic Association both suggest that a male after the age of 50 have a PSA blood test and a rectal exam to check for cancer of the prostate. This should be done whether you've had a vasectomy or not. Thank you for your time, and I'll be in a few moments to answer your questions and examine you.